Back with you, and thanks for staying on. The Gauteng Health Department is in the process of reviewing and proposing new tariff adjustments for hospitals. Current rates are determined by the Uniform Patient Fee Schedule. We get to know what that means, which uses the means test to determine who can afford to contribute while also protecting the indigent. Let's talk this now with Gauteng Health Revenue Management Director Emma Mathibedi. Good to have you, and thank you very much, Emma, for your time. Let's get the context first. I mean, in 2025, a 4.4% increase was applied to most services, with a 30% increase for emergency medical standby. Why is there a need for another increase?
Good afternoon, and thank you, Thabo, for the interview. Yes, there is a need for the increases and follows on a yearly basis in terms of aligning our tariffs. And as these are also the nationally determined tariffs, where all the tariffs are determined at national, then as provinces, we also have to align and adjust the tariffs. So there's just that 1% more increase from the previous year's tariffs, those that were at 4.4%. These ones will be at 5.4% adjustment.
So with these proposed fees, what are the changes that we are likely to see in 2026?
The changes that we'll see is that patient will just pay that additional extra 1% in terms of the fees that they were paying before. And this will also assist in terms of the department generating and collecting revenue. That will also assist in helping in terms of the budgets of the departments.
And what is really the aim of this proposal? I mean, what exactly? Because people would say, what are we going to benefit from it in terms of better services? I mean, people are saying, we can't afford the increase, but talk to us about what is the service quality going to be versus this cost, maybe 1% that we're going to pay.
Yes, it is crucial that tariffs have to be adjusted so that the department can also be able to afford that quality healthcare services, because without money, without funding, then will not be afforded that opportunity to be able to improve our services. So this is just a call to the public that it is important that we keep adjusting the tariffs, and then services at hospitals, people get to know that they need to pay for them so that the department can improve its accessibility and affording the public the high quality healthcare services.
Yeah, but Emma, I mean, somebody would say you gave us an increase last year of 4%, but still, when we look at the current services, nothing has improved. For example, people will say we still stand in long queues. There could be only 2 nurses in a full ward. There's broken equipment. There's long waiting time in casualty. So the public would push back, highlighting these issues and saying these increases are unjustifiable given the current state of affairs.
Yes, they may say that, but there has been a lot of improvement within the department in terms of healthcare services. And then if we do not increase the rates, then the matters can even go worse. If we do not have money, then we won't be able to render the quality healthcare services. And these tariffs, the people that will even be paying more, it will be the other categories, because the indigent patient and the vulnerable are still protected in terms of these tariffs, where they will not be paying some, and some will be paying at even lesser rates.
Yeah, talk to us about that, how, for example, households with low income are going to be affected, because the other pushback from the voices that have been asked on this increase, saying there is a rising cost of living generally in the country, and these hikes will disproportionately impact low-income earners.
Yes, with the low-income earners, they have been specifically catered for because they are already subsidized, and then they are paying a lower rate of their fees. The state is still subsidizing for them. They will just be paying on average, it can be around 5 rands increase for what they will be paying. So these tariffs have really taken care of the indigent patient, and there will also be those that will not even be affected by these rates, that they will still be receiving healthcare services for free, which will be the categories of our elderly patients, the recipients of social grants, the people with disabilities, our vulnerable groups, which are our children under 6 years old, and also the women who are pregnant. They are not paying for services at public healthcare services. So those categories are really catered for, and it will not have an impact on them.
Yeah.
So the other categories that will be paying for is those that will be having funders belonging to medical schemes and so forth. So the tariffs and the department has really taken care of the vulnerable groups and the indigent patients.
Is this the department suggesting to the public that the department is unable to recover monies lost to corruption and mismanagement? I mean, why do you consider increases first as opposed to recovering lost monies and management accountability as far as that is concerned?
With these tariffs, this is a separate process that is specifically relating to the adjustment on patient fees. But then in terms of recoverability, there are also other measures in place to recover the monies that those that owe the state will need to pay for them. But then we need to align in terms of adjustment of the tariffs.
Yeah. And how are you dealing with the question of people saying, well, we are paying for these services, or we are paying for the upkeep of these facilities, yet there are those who are not citizens who are benefiting from this infrastructure?
Yes, Thabo, as you may know, that as a country, we are expected to render healthcare services to all. In terms of the Constitution, every person who accesses healthcare has to be given healthcare services. But then there are measures in place that even people who are outside of the country, they are also paying for the services, and they will be subjected to the same tariffs also that is also payable by them.
So where you are applying a means test, are you saying it's the same means test even to non-citizens that will be applied?
The means test is applicable to South African citizens. The foreign nationals, they are paying the full UPFS rates. They can just be those categories of foreign nationals that will also be subjected to the means test, which are the asylum seekers and the refugees, those with those valid refugee status. Because in terms of the law, they have the similar benefits in terms of the Immigration Act that covers them in that regard.
So let's be clear that these are draft tariffs which you have published since the 20th of February. Have you been receiving any engagement as far as the comments process and the consultation process is concerned?
Yes, they have been published for the public to give comments, and then we are awaiting until the period has expired of 30 days, which will be expiring on the 20th of March. So the public, we are still expecting their comments.
So where do they do that? How do they engage with the process?
Yes, the notice has been published in the Government Gazette, where the public can access that notice number 176 for free, and then they can be able to raise in their written comments that then they can submit. It is notice number 137 of 2026, where they will get it at www.gpgonline.gov.za, and then they will have an email address there where they will be able to submit the written comments.
And those who have no access to those platforms, is there other means and ways, particularly if you're talking about low-income earners that might not have access to this connectivity? How are they to engage with this process?
Yes, with those ones, there will also be some other arrangements that are done, like the imbizos, where they are informed about these proposed tariffs. Then that's where also they can be able to voice out their comments.
All right, Emma Mathibedi, we appreciate your time and thank you very much for coming on. Gauteng Health Revenue Management Director there, Emma Mathibedi.